Welcome to Open BXRx on BronxNet. I'm your host, Sonyi Lopez, inviting you to get social with us at BronxNet TV on Instagram and Twitter, and BronxNet Community Television on Facebook. Medicare's open enrollment or annual election period began on October 15th. This means that Medicare users now have the opportunity to reevaluate part of their current plans. COVID-19 has shown us how important it is to have access to convenient, high-quality, comprehensive coverage. Oscar and Montefiore have partnered to offer convenient and affordable care with the doctors you trust. Joining us now to share more is Dr. John Murphy, Northeast Regional Medical Director at Oscar. Welcome. Thank you so much for joining us, Doctor.
Thank you, Sonyi. My pleasure.
So first, for those who are not familiar, can you share more about Oscar Health Insurance and your mission?
Absolutely. Well, to begin, Oscar has grown significantly since its inception in 2012. Currently, we have over 420,000 members in about half of U.S. states. And our mission from the beginning has been to focus on members and their needs. Firstly, by providing affordable health care without sacrificing high quality. It's our goal to help members to stay healthy and get the most out of their plan with Oscar. Finally, we want to guide our members to doctors and to hospitals like Montefiore that they trust. And lastly, we want to facilitate relationships. First, personal relationships between members and their physicians so that they can get optimal care and they're well known to their doctors. And secondly, to facilitate relationships with Oscar itself so that our members can take advantage of everything that we're bringing to the table.
Thank you, Dr. Murphy. And just, we're speaking to Bronxites, and Bronxites are viewing the show now. And we just want to speak about ensuring that Bronx seniors choose the right plan, especially while navigating this pandemic. How can we ensure that through Oscar?
Absolutely. Well, the first thing to realize is that healthcare changes over time, and our healthcare needs change over time with a number of things. The first being age, and the second thing is with environmental influences. And the best example right now of that is COVID-19. And this pandemic has made it very difficult for all of us to access our health care. That being said, we know that the people of the Bronx are very strong, they're very independent, they want to manage their own health care, and they want to be participants in maintaining their health. And basically, we want to help them to do that, and Medicare Advantage offers them significant options to customize their health insurance to meet their individual needs. And the best time to take advantage of those opportunities is during the AEP that's currently ongoing.
And speaking of the enrollment period, please tell us more about Oscar's partnership with Montefiore in Medicare Advantage. What is it, and how can people sign up?
Sure. Well, Oscar's partnership with Montefiore began in 2019. And as I said, the fundamental tenet of it is to provide convenient, affordable care with doctors you trust. And we have basically been able to create a network of trusted physicians and health systems that we vetted, namely Montefiore physicians and the Montefiore health systems that we know provide high quality medical care. Furthermore, we know that our members in the Bronx are familiar with them and trust them because they're in their own community. But in addition to this relationship that Montefiore brings in terms of high quality, there are several things that Oscar also brings. The first is we have a concierge connected care team. And the purpose of these guides is to help our members to interface with Montefiore in order to simplify those interactions and to the extent that we can to make healthcare easy. The second thing is, in many ways, Oscar is a technology company. And one of the things that we're able to do is to leverage that technology on behalf of our members. So for example, we offer virtual care in the form of telemedicine, not as a replacement for the patient's in-person visit with their primary care doctor, but to supplement it, for example, in times like these, when it's simply inconvenient to make a trek to the doctor's office. So that's a very valuable add-on.
Doctor, let's track back just a little bit. Can you help us define what an Medicare Annual Election Period is and when it ends for anyone who's listening and may not be familiar with the terms?
Absolutely. Well, the so-called AEP is an opportunity for everyone who's enrolled in Medicare to take charge of their health care. It's an opportunity for them to disenroll in their current plan, to re-enroll in another plan, or potentially to change the plan that they're in within a particular provider. The actual period itself extends from October 15th through December the 7th, and any benefits that are elected will take place then on January 1st, 2021. There are a number of questions that always arise as how do I choose what to do during the AEP? It's very confusing. Well, there are a number of things that people should consider. First is, what are the out-of-pocket expenses relative to my needs? So for example, depending upon the plan, Oscar offers an opportunity to have a $0 premium plan, a $0 co-payment with their primary care physician. And these are things that tend to be very attractive with patients. In addition, people should be concerned about prescription drug benefits because the prescriptions that we need are very, very expensive. Again, depending upon the plan, Oscar offers $0 copay for Tier 1 and Tier 2 drugs. We offer same-day reordering over the phone and zero-cost same-day delivery of those prescription medications. Other things that people should look at is what is the star rating of the plan. The higher the star rating, the higher the quality of the plan. They should also look at that menu of extra benefits that we talked about. One of the things that some members don't realize is we're obligated to produce benefits that are equal or better than what Medicare itself provides. And in order to be competitive with other Medicare Advantage companies, we offer that menu of additional benefits. At Oscar, they include vision, they include dental, they include hearing benefits, which are very unusual. In addition, there's a very lucrative over-the-counter pharmacy benefits, all of which our members find to be very valuable.
Thank you, doctor. And what is the initial enrollment period? Who does this apply to?
The initial enrollment period is somewhat of an automatic enrollment in Medicare that happens generally around the 65th birthday of Medicare eligible people. It usually begins around 3 months before and extends for about 7 months. The point that's really important here is that the annual enrollment period is much more beneficial to the patient for a couple of reasons. Number one, they understand the Medicare system a little bit better. And number two, they've had a chance to evaluate their own healthcare needs over the year and consequently have a better ability to customize a plan that's very specific to their needs.
Sounds wonderful. And as we know, shopping for Medicare can be very tricky. How does Oscar make this process easier through things like the Oscar app?
Well, Oscar does a number of things. The first is we provide enrollment guides so that people understand what the benefits available to them are. In addition, we have a team of personal guides who can talk members or prospective members through the pros and cons of various plans that they're considering. We do have a very robust website with lots of information. And as you mentioned, we have a telephone app with the same bit of information. Just to note, we also offer 2 plans in the Bronx this year. And that, again, is along the philosophy that we want our members to be able to customize and choose the plan that's best for them. So if they have more significant health needs, there's a particular plan that they might want to choose. If they're a little bit more cost sensitive, there's a plan that's also eligible for the low-income subsidy provided by the government. So again, choice to meet your individual needs is very important to us.
And how can people find out more and sign up to get connected with Oscar?
Well, there are 2 ways. The first is they can give us a call at 718-514-2374. And the alternative is to just log on to our website at hioscar.com/Medicare.
Thank you, Dr. John Murphy, for joining us today and telling us a little bit more about Oscar and Montefiore's partnership in Medicare Advantage.
Thank you. My pleasure.
Of course. Folks, again, the number's on the screen if you want to make a change but aren't sure how to get started. It's 718-514-2374. You can find out more information on Montefiore and Oscar plans. And remember, the annual election period ends on December 7th. Act now so you can get the Medicare Advantage you've earned. We'll be right back.